Hello everyone. My topic is male infertility, functionality and surgery. My name is Anett Szabó and I work at the Andrology Center. My vision is to educate patients regarding our findings on the risk factors that influence male fertility, and my mission would be a larger scale education of the population. We have four topics altogether. Two of them are about sperm DNA fragmentation, and another to look at some subpopulations of the patients attending the clinic. The first one is the risk factors associated with sperm DNA fragmentation. As a background, we can say that infertility rates are quite high in developed countries, and sperm DNA fragmentation impacts fertility. Some of the risk factors that influence sperm DNA fragmentation include lifestyle, diet, obesity, smoking, and so on. And our aim was to investigate their effect on sperm DNA fragmentation. The clinical question was, what is the correlation between the different risk factors and sperm DNA fragmentation? And to find out, we looked at any male, regardless of their fertility status. We looked at any risk factor that's been studied and compared it to the absence of that risk factor, and the outcome in every case was sperm DNA fragmentation. Our hypothesis was that there is a correlation between the studied risk factors and sperm DNA fragmentation. For this, we did the search and found almost 27,000 articles, and we extracted data from over 200 articles and ended up with information on more than 50 risk factors. Just a few words on sperm DNA fragmentation. It is the only evidence-based sperm functional test available, but there aren't any exact cutoffs for the optimal range. But we can say that we prefer to be under 25%. Between 20 and 35%, we may expect adverse pregnancy outcomes, but between 25 and 50% of sperm DNA fragmentation, the sperm is still good for in vitro fertilization. We did subgroups according to the assay type used, and also according to the fertility status of the males. These are the risk factors that we found. For the red ones have been included in the meta-analysis, and the black ones, we have less data for that. That's in the systematic review. Just to show you some clinically and also statistically significant risk factors, when looking at patients with varicocele and comparing them to patients with no varicocele, the difference in the mean difference of DNA fragmentation was almost 14%. When comparing smokers with non-smokers, the difference in their DNA fragmentation is almost 10%. When looking at abnormal glucose tolerance versus normal glucose tolerance, the difference in these patients' sperm DNA fragmentation is again almost 14%. And when looking at different age groups, we found that there is a more rapid increase of sperm DNA fragmentation after the age of 50. And it's again almost 13% of difference. So just to say a few words in conclusion about the above-mentioned risk factors, varicocele, abnormal glucose tolerance, smoking, and increased age certainly increase sperm DNA fragmentation. And if we look at the more detailed forest plot, we would also see that there is a dose dependency for the cigarette smoking as well. Some of the strengths include that we looked at every risk factor that's been studied so far in relation to sperm DNA fragmentation. We have a high number of articles included and also a very high number of patients. But some of the limitations include that there are no longitudinal studies. We can't exclude every risk factor and look at only a single one. And for some risk factors, we have a low number of studies, and almost in every case, we have a high heterogeneity. As an implication for practice, with this knowledge, we can give specific suggestions for the patients on what might be affecting their fertility. And as an implication for research, we would certainly need more research for most of the risk factors, and for this, the establishment of registries would be essential. The status of the manuscript is this. We're right before submitting it, so we have sent it out even to the language check, and the internal review has been completed. Our second topic is also related to sperm DNA fragmentation. We'll look at the interventions that could possibly improve sperm DNA fragmentation. The background is almost the same. As we have seen before, there are many different risk factors that may influence sperm DNA fragmentation. Thus, there are very different interventions that could potentially improve it. Our aim was to investigate the interventions that could improve sperm DNA fragmentations and thus give a guide to clinicians and also patients on how to improve their fertility. The clinical question was, do lifestyle changes and medications aiming to increase male fertility decrease sperm DNA fragmentation? For this one, we have the same P and O as for the previous topic, and the intervention is any lifestyle change medication compared to the no lifestyle change, no medication, or a placebo. With the second one, we are doing the data extraction. We are pretty much halfway through. We are at letter N. And some of the interventions that we've come across so far are varicocectomy, antioxidants, exercise, antibiotics, enzymes, and so on. Our fourth topic is the prediction of sperm retrieval in non-obstructive azoospermia via an artificial intelligence software. As a background, azoospermia means that there is no sperm in the ejaculate. There are two types, the obstructive and the non-obstructive, and we were looking at the non-obstructive type here. And for this one, the best surgical approach to retrieve sperm is the testicular sperm extraction. There are no current means to predict whether we find sperm when doing the surgery or no, but the parameters of interest seem to be the ones here. These are all endocrine parameters. And our hypothesis was that success of sperm retrieval can be predicted via preoperative parameters, and the clinical implication would be to avoid unnecessary surgeries and select the best candidates for the surgery. Here we have data on 150 patients approximately. That's been analyzed. Now we have already sent another 50 patients' data for more analysis. The software can be retaught, so that's what they're doing from today again. The accuracy at the beginning was 65 to 70% of how well it could predict whether we find sperm or not. But then it decreased, and now it seems to increase again. So that we hope that we can even further increase it to more than 70%. And we have one more project. We have extracted the data for the non-palpable testicular masses and their testis-sparing surgeries. And as we're doing the other projects, we're waiting for more patients to arrive. So these are our goals. Most of the studies will be submitted this autumn, and the last one will be submitted in the winter. And the quote is, "Today is the first day of the rest of your life. Make it worthwhile to continue." Thank you for your attention.
Thank you, Anett, for your great presentation. I wanted to ask you that, is there any data in the literature that with the suggested lifestyle changes, for example, quitting smoking, that how long does it take to increase the fertility and reduce the DNA fragmentation?
Well, in our pool of data, we haven't come across any studies where they actually managed to make patients quit smoking. The lifestyle interventions that they usually advise are diet and exercise. Usually, none of them aimed at smoking. So we don't have data on that. We have the data for the ones that I've listed before.
Congratulations for your great progress. If I may be a little bit provocative concerning your fourth project with the really interesting artificial intelligence, You showed us that the hit rate or prediction rate was around 65 or 70% in the first round, and then it decreased, and then you are reteaching and
Yes.
the whole thing. That in our clinical practice, what do you think would be the accuracy rate of a tool like this? Where under which point would you tell a patient that they should not opt in for a sperm extraction, because this is a kind of a life or death question. So if I would like a kid and I got only 1% chance for this operation to have a child, then of course if I want it very much, then I would go for the operation for that 1%. So what do you think about this? This is a really tough question, but what do you think of it?
Well, we want to increase the prediction rate to over 70%. I think the 70 wasn't a bad prediction rate either, but even an 80 would be like pretty much ideal. I think it's not up to us to decide whether we would do the surgery or not. I think it's up to the patient rather. If they have a slightest chance of having a child, then we would give them the opportunity. We would just tell them that, look, we have this prediction. It says that you have very slight chances of having sperm. It's up to you to decide. We would tell them the advantages, the disadvantages, and they can decide for themselves.